So this role play will begin after some history taking has already taken place. So we will skip the introductions. To start the role play, we can either assume a name for the patient ourselves, or we can check with the interlocutor what name they would like us to use. So Bhumika, what name can I use for you?
You can call me Khaira.
Okay, so I'm starting the timer. Thank you for answering all the questions, Khaira. You've been very patient. I'd just like to ask you a few more questions. Is that okay?
Yes, doctor.
Could you please tell me how long you have had these symptoms for?
For a couple of days, doctor.
Okay. And is there any discharge from the eye?
Yes, doctor, I noticed a clear discharge.
It's a clear discharge, right? So it's not purulent, which means there's no pus discharge for it.
No, doctor, no pus.
Right. Thank you for sharing that. And one final question. In the past, in the recent past, have you had any cold or any respiratory symptoms?
Yes, doctor, actually, I had cold last week.
Okay, that's helpful information, Khaira. Thank you. So, based on the symptoms and what you've told me, you're suffering from a condition called conjunctivitis. The common term for it is pink eye. Have you heard of this before?
No, doctor.
Okay, let me explain. So, this is an inflammation of the outer eye layer, right? And this can be caused by virus or allergens in the environment. Nothing to be alarmed about. It is easily curable, and I'll talk about the treatment options now. But before I talk about the treatment, is there anything that you'd like to ask?
Yes, doctor, I do have a question. Like, what could be causing these symptoms and how long this is likely to last?
Right. So for the first question, what could be causing it? So virus and allergens, they are likely to be the triggering factors. Like you mentioned, you've had a cold in the past, right? So that could be contributing to it. And in regards to your second question, how long will this last? So this is an infection. It will resolve quite easily with the treatment that I will prescribe.
Okay.
May I talk about the treatment options now?
Yes, doctor.
Right. So, to ease your symptoms and to expedite the recovery process, I would suggest a multifaceted treatment strategy, which would include three things. The first thing would be to use medicines. These are called antihistamines, which would just relieve your allergy symptoms like any itchiness or discharge from the eyes. Would you be able to do that?
Yes, doctor.
Lovely. The second would be to alleviate any discomfort. I'll recommend hot and cold compresses. Is that doable?
Yes, doctor, that is.
Great. And the final thing would be maintaining good eye hygiene.
Okay, doctor.
Any questions so far?
Yes, doctor, if I bathe my eyes in salty water, will that be helpful?
Okay, that's a good question. I'd suggest, Khaira, that we stick to the treatment that I will prescribe. I think this would resolve the condition much more quickly.
Okay.
Is there anything that you'd like to ask about what we've discussed so far?
Yes, doctor. How helpful an allergy test would be if this condition happens again?
Okay, see, reoccurrence is possible, but most cases, like I said, it's a common condition. Most cases clear up with the uh, treatment that I have prescribed. And right now, our main focus is to clear this infection. I wouldn't suggest an allergy test unless there's a reoccurrence in the future. So for now, I think just start with the treatment, and we'll come to an allergy test if there's a need for it in the future.
Okay, doctor.
Right. Is there anything else that you want to ask?
Yes, doctor, I'm really concerned that it will affect my vision. Is that so?
It's great that you're cautious, but I'd like to reassure you that it will have no permanent effect on your vision. Once the infection clears up, your vision will be back to normal.
Okay.
And now that we're talking about the management of symptoms, I think, and I touched upon the eye hygiene before as well, this condition is contagious. So we'll have to minimize the spread of this condition. And I'd like to talk about a few things if that's okay with you.
Yes, doctor, that will be fine.
Right. So please make sure that you do not share any face washes or bed linen with others in the home. Right. Until
Mhm.
the infection clears up, I would suggest that you keep these separate because, as I mentioned, this is something that can spread very quickly, and we wouldn't want that to happen.
Okay, doctor.
Great. So do you want to ask anything about all that I've shared with you?
No, doctor, I've understood everything.
Okay. To make sure that you've understood the treatment options and what we've talked about correctly about minimizing spreading as well, could you please repeat to me to ensure that we're on the same page?
Yes, doctor. Firstly, you told me that I will be using antihistamines to prevent allergy and warm and cool compresses. And thirdly, I need to maintain a good eye hygiene. And other than that, to prevent my family members, I shall avoid using face washes and bed linen.
Okay, that's great. I'll prescribe the treatment now, and you can let me know if there are any further questions or concerns.
Okay, thank you.